We continue with treatment principles with another case history. The patient is a woman aged 72. She had been suffering from chronic bronchitis and emphysema for a very long time. She caught colds easily, was breathless, and coughed up a lot of sticky yellow sputum. Her pulse is slippery and both front positions are weak. Her tongue is red with sticky yellow coating. During the course of treatment, she caught a heavy cold and had the following symptoms: aversion to cold, a headache, cough, runny nose, sneezing, breathlessness, and a floating pulse. So for the diagnosis, there is retention of phlegm heat in the lungs and spleen chi deficiency. During the acute exterior attack, there is invasion of the lungs defensive chi portion by exterior wind cold. So to explain the diagnosis, this condition is chronic, and as often happens in chronic conditions, there is interior heat. There is also phlegm, which is caused by deficient spleen chi being unable to transform fluids, which accumulates into phlegm. The spleen chi deficiency is the root, and the retention of phlegm in the lungs is the manifestation. The upright chi is weak, and there is a pathogenic factor in the form of phlegm heat. Hence, the condition is a mixed, deficient, and excess one. The acute attack of wind cold represents another root causing the various clinical manifestations. So for the treatment principle, treatment must primarily be aimed at the root, and that is tonifying spleen chi, because as long as the spleen is weak, new phlegm will always be formed. However, the clinical manifestations are in this case severe and distressing and also need treatment. So in this case, both the root and the manifestation need to be treated simultaneously, and the treatment must combine tonifying the upright chi, in this case the spleen chi, with resolving the pathogenic factor, in this case the phlegm heat. During the acute attack of common cold, the treatment principle is entirely different. In this case, treatment of the acute condition takes precedence over the chronic one, as this patient has emphysema and chronic bronchitis, and therefore an exterior attack of wind cold can have a very serious consequences if not treated promptly. The wind cold attack, for instance, could very easily turn into pneumonia, considering the tendency to lung trouble and the retention of phlegm heat in the lungs. During the acute attack of wind cold, the primary aim of treatment is to expel the pathogenic factor first and tonify the upright chi later. Points used to expel wind cold were lung 7 and bladder 12 with cupping. Thank you for your attention.